We last left off inspecting Tracy's neck from the posterior angle. So it's a natural place to go ahead and begin the posterior chest exam. We always start with inspection. So what I'm going to be looking for with Tracy is symmetry within her musculoskeletal, shoulders and back, natural rise and fall of her posterior chest with each breath, and also doing a skin assessment where I'm looking on at her back for even skin color throughout the rest of her body, feeling for the temperature. I'm looking for any abnormal lesions, specifically suspicious cancer-looking lesions, because this is an area not commonly seen by the patient herself. I'm also going to palpate for any crepitus, any tender spots, Tracy?
No, there's not.
Okay, and at this point, I'm going to go ahead and assess for tactile fremitus. Using the palmar aspect of my hand, I'm going to have her say, Tracy, every time I move my hand, I would like you to say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
With tactile fremitus, I can feel the vibrations every time she says 99. This is normal. The vibrations should be symmetrical on both sides. An abnormal result would be is if you could feel the vibrations on one side and not the other. And when you're doing tactile fremitus, you want to avoid the bony prominences. You're feeling the intercostal areas vibrating on the muscle area. The next thing I would be doing in my assessment is percussion. Taking the non-dominant hand, spreading the fingers apart in the same area we began before, in the non-bony area. With my middle finger on my dominant hand, I'll be percussing on this joint. Tap, tap. Again. I'm listening for resonance. Avoiding the bone areas because it's just going to give a dull sound. Mapping out the borders of the lung. And once again, should be bilateral and symmetrical sounds. Next, I'm going to be auscultating for breath sounds in all 9 fields using a ladder approach, systematically listening for equal sounds on both sides. Posteriorly, the lung sounds should be vesicular in nature. Tracy, please take a deep breath and hold it, or inhale and exhale. Specifically looking for any adventitious breath sounds that would include rhonchi, rails, crackles. And her lung sounds are clear in all fields. While I'm right here, I'm going to go ahead and test for her chest expansion, putting my hands at the base of her lungs and pushing in together with my thumbs. I'm going to have to take a deep breath and let it out. And this is normal because my thumbs are expanding equal at the same rate on both sides. Next test I'm going to do is called whispered petriloquy. It's for whenever you suspect there might be some consolidation in the lungs. What I'm going to have you do, Tracy, is whisper 1, 2, 3 when I place my stethoscope, okay?
Whisper 1, 2, 3. 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 Whisper 1, 2, 3.
And so on. Whisper petriloquy, what I should be hearing, I should not hear any of the whispers. I can see her lips moving, but I shouldn't be able to hear the 1, 2, 3 through my stethoscope. If I can hear the 1, 2, 3, that indicates consolidation in the lungs. Also with bronchophony, I would have her repeat phrase 99, and that should come through the stethoscope as muffled, muffled sounds. If I could hear her clearly saying 99, that would also indicate consolidation in a particular area of the lung where I could hear it clearly. Egophony is another type of consolidation where I would have Tracy say E. Say E, Trace.
E. E. E.
And so on. Egophony should sound like E. If it sounds like A through the stethoscope, that would be an abnormal result indicating possible consolidation. Go ahead and turn a little bit on that.
Yes.
When inspecting anterior chest, once again, I am looking for symmetry of the shoulders and symmetry with the rise and fall of the chest. I'm palpating for crepitus or any tenderness. And once again, I could do tactile crepitus on the front. It's a little tricky because the muscularity of the male and breast tissue of the female can make it difficult to feel the vibration, but we'll just go ahead and do a little bit. Say 99.
99. 99. 99. 99.
And so on. Once again, making sure that the vibrations are not just felt, but are felt bilaterally with equal symmetry. I'm going to go ahead and listen to we don't percuss on the anterior chest for the same reasons. You can't really get a good resonant sound with muscularity and breast tissue. So at this point, I will go ahead and auscultate the anterior chest. Take a nice deep breath. Once again, the same ladder formation, listening for, up here you may have some tracheal sounds, but as you move down the lung, you should have vesicular sounds. Same ladder approach, prime areas, comparing each side. In this case, I would typically have the patient adjust their breast tissue so I could hear better. It's more comfortable to have the patient adjust their own than try to do that while listening. And normally this would be directly against the skin so you could hear things better. All her lung sounds are clear. And once again, you would perform your whispered pectriloquy on the anterior chest just like you did the posterior with the whisper test in all 9 fields to rule out consolidation. Noting that, once again, you should hear clearly the whisper 1, 2, 3 through the stethoscope. Egophony, same fields are being auscultated. You should hear E, not A, and bronchophony, auscultating the same fields, hearing a muffled 99 and not a clear 99. A clear 99 would indicate consolidation. At this point, I'm going to have Tracy lay back, and we're going to begin the cardiovascular part of the assessment. We've already assessed the skin on the chest when we were doing her chest assessment. So at this point, I'm going to first auscultate all 4 valves of her heart with both the diaphragm and the bell. I'm going to be counting down the second intercostal space, left sternal border, to listen to the aortic valve. First with the diaphragm, then with the bell. Inching down to the third intercostal space, left sternal border. For the pulmonary valve, pulmonic valve, first with the diaphragm, then with the bell. Then down to the fourth intercostal space for the tricuspid valve, first with the diaphragm, then with the bell. moving down to the fifth intercostal space, mid-clavicular line, for the mitral valve, first with the diaphragm, then with the bell. This is also an appropriate time to listen to the carotid artery for brewing. Earlier you would have palpated for a thrill. You also take for brewing with the diaphragm, then the bell, and then listen to the apical rate of the heart. A normal adult heart should have between 50 and 90 and have a regular rhythm, which she does. She has a strong regular rate and rhythm. Now moving along to the peripheral vascular assessment, you begin with the upper extremities, starting with the skin assessment, looking for even coloring of the skin, which it is consistent with the skin on the rest of her body. Palpating for temperature, she's warm. Coloring sometimes bluish or purple, cyanotic coloring of the fingertips could be a sign of poor circulation. Moving down to her lower extremities, I am inspecting her skin for color and hair distribution. A lack of hair on the legs, specifically the toes, could indicate possible peripheral vascular disease. I'm palpating for temperature. Both her lower extremities are warm. And for edema, pressing down on her tibia to see if there's any pitting, and she has 0 pitting, so indicating no edema. I'm also paying attention to see if there's any varicose, any varicosity in her lower extremities. And at this time, I would go ahead and check the brachial pulses in her upper arms to make sure they're strong and equal bilaterally. And then her radial pulses, strong and equal bilaterally. Her femoral pulses, and then popliteal. To feel popliteal pulses, you put both hands behind the knee, bend it a little bit, and then move your fingertips apart so you can really dig in there and try to feel those popliteal arteries. They can be difficult to palpate. Full size. Those are strong and equal bilaterally. And then the dorsalis pedis pulses. These you don't want to press too hard because you can occlude them. They're strong and equal bilaterally. And then the posterior tibialis, that's just behind the malleolus. Those are also strong and equal bilaterally. This concludes our peripheral vascular assessment and exam. Thank you very much.